Hey, I want to give you guys some specific neck exercises. Most neck exercises are really targeted at the muscles of the spine. They're either strengthening exercises or they're stretching exercises, but most of the problems with the spine come from the joints of the spine. And as you as patients in our office are probably well aware of what a subluxation is, old injuries, traumas that cause damage or misalignments to the spine, they don't allow proper movement and proper function. Ultimately, motion is life to those joints. Most of the problems of the neck and the spine are not muscular. Most people may think they are, but they're generally coming from the joints of the spine. They're not a muscle problem, they're a joint problem. And what happens is when those get misaligned or subluxated, they cause damage and wear. The joints of the spine begin to break down. They go from healthy discs and healthy nerves to over time, because of lack of proper movement, lack of proper function, the discs break down and degenerate, bone spurs start to form, which causes more damage to the nerves. And the nerves are what run and regulate everything in our bodies. So when those are interfered with, they can not only cause neck pain, numbness and tingling in our arms and hands, but also cause headaches, migraines, sinus problems, allergies, even thyroid issues. So we got to protect the spine, because as it begins to wear and degenerate, and by the way, that's degenerative osteoarthritis, which is not a disease. It's not a bacteria or a virus, and it's not genetic or congenital. It's not something you're born with. It's literally mechanical wear and tear where the joints are no longer working properly. So the exercises I want to give you are going to target those joints in the spine. And so especially if you've had a pause in your care because of isolation due to the coronavirus, important to keep good movement in there. We don't want you to lose your progress. So these are going to be really important. And if you've been given home care, if you're supposed to be laying on a den roll, make sure to do that every day. Take good care of yourself. Do the home exercises we've given you, and here's something specific that'll be able to help to improve those ranges of motion and keep movement in the spine. It's not going to be a replacement for your adjustments. We're just trying to keep movement so it doesn't completely lock back up on you, and we're not starting over. So what we want to do is create a repetition of movements. And as we go through this, I want you to work within pain-free ranges of motion. I want you to make sure that if you do develop stiffness, soreness, pain, or you're going through this and it's causing pain or numbness in your arm or something like that, then just stop. Most of that is caused from creating irritation, inflammation where those joints are damaged. And so you're just going to want to ice. Ice for 30 minutes, do it a couple times a day, or you can do it more frequently. But you just want to knock out the inflammation. And even if you're having problems with it, most everybody will still be able to do these. Just work within your limits, work within pain-free ranges of motion, and you'll find the more you do this, the more you're able to do it. It's going to gradually and progressively improve. So today we're going to start out with 25 repetition of 25. You can build up doing 30, 40, 50, do it multiple times a day. The more you keep movement in those joints, the healthier they're going to get, and the better range of motion you're going to have, which ultimately will take stress off the nerves and make you healthier. So if you have to start with just 5 or 10 repetitions, do it. But gradually your body will adapt to whatever you're doing and you will continue to improve. So let's start with, we're going to do, basically there's 6 cardinal ranges of motion. There's flexion, there's extension, there's rotation both directions, and then there's lateral bending ear to the shoulder both directions. We're going to do all 6 of those. And so I'm going to demonstrate it. It is seeming like a lot of repetition and redundancy, because we're going to go through initially right now 25 repetitions. So you're going to have you sit up nice and straight and tall, and you're going to start with flexion and then extension. That's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, and 25. So you might even feel yourself a little bit lightheaded. You might feel a little more energy. Gets good circulation moving too. So now we're going to do rotation. We're going to rotate over our shoulder. There's 1, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, and 25. So the last one's going to be ear to the shoulder. I'm not going to make you go through it with me, but you can do those on your own. But basically, you're going ear to the shoulder on one side, ear to the shoulder on the other side. You're just going down on both sides, and we're going to do 25 repetitions of those. These exercises are going to help improve the ranges of motion in your spine and work more targeted at the joints as opposed to the muscles. So be consistent with these. Do your home exercises. If you'd like to try and get in for adjustments, let us know. We will do whatever we can to make this a safe environment for you to be able to do that. We don't want you to lose the progress you've had, even if you're getting periodic adjustments. Maybe you're supposed to be coming in 3 times a week. Maybe you only want to do one or one every couple of weeks, but don't want to have a big loss of the work that we've done. Let us know. We have some options for you. We're keeping the office clean and sterile, wiping everything down between adjustments. But here's a couple options for you. If you'd like to have a separate, isolated room that's totally sterilized, we can do that for you. So just contact our office, let us know. You can pull up, you can text message, let us know we're here. We'll text you when you're ready. You can just come in, go to the isolated room, get adjusted, and be out. That'll create an environment that hopefully makes you more safe and secure. The other thing that we've actually done, and when we get nicer weather here, it looks like we may have some this week, we've even had people that have had adjustments outside. So set up a portable table outside, and if that's something that you want to do, we'll try to make that happen for you. We just try to do it at a time when we don't have other patients here. We are keeping a big separation between our patients, so there aren't people in the office. But if you want a time when there's nobody here, we're happy to do that for you. If you want to have a drive-through chiropractic session outside, we can do that as well. You just let us know. You'll text message when you get here, and when we're ready, you can just jump out of your car, jump on the table, get adjusted, and do your thing. But we'll do everything we can to keep good health and alignment in your spine to complete your program of care. So when you get to those post x-rays, we can see phenomenal results. So anyway, I want to thank you guys. Stay working on your home care, and we'll look forward to seeing you soon.